Everybody, welcome to Dr. Harry's Healthy Corner, and I am Dr. Harry. It is Wednesday at 7:30, and it's good to be back here chatting with you. And today, what I wanted to talk about was, do we need supplement as we get older? And if we do, why? And perhaps what kind of supplements? And so these are the things I wanted to talk about today. But before we jump into that, here are my 3 hard and fast rules when it comes to supplements. Nutrition and food is first. That's number 1. Supplements are just that. They're supplemental. And number 3, too much of a good thing is many times just simply too much. So having said all that, let's talk about some changes that happen as we get older that may indicate that we may need to take some supplements, or at least to find out if we are deficient in those nutrients. Okay, so let's start with the stomach. Well, what happens in the stomach is that our ability to digest and absorb can become less as we get older. Our stomach cells themselves start shrinking, and that's referred to as gastric atrophy. And as they do that, we actually produce less stomach acid, and we produce less of other things that helps us to absorb nutrients such as vitamin B12, iron, and even magnesium. So our minerals could be significantly impacted if our stomach cells start atrophying. Other changes that can happen in the GI tract is that we may start becoming constipated. Many of you have experienced that. And so we may start also being able to make less nutrients in the small intestine. So those are things that can happen as we get older. Let's talk about our bones. We've done osteoporosis in the past, so those of you who've listened in have heard that talk. But what happens is that our bones start becoming thinner, and therefore they can break more easily. And that is called osteopenia or osteoporosis. In fact, we may actually start losing about 1% bone mass a year, which can end up being pretty significant as we get older. And so therefore we have to pay attention to things that we can do, and foods that we can eat, and nutrients perhaps that we can take that can help us to keep our bones strong and healthy. As we get older, another thing that studies tells us has a chance of happening is our inflammation status starts increasing. We start becoming more inflamed, and our immunity starts going down. So we start being able to fight off illnesses less. These are 2 very important things that can happen to us, because it sets us up for chronic illnesses such as diabetes, high blood pressure, heart disease, and perhaps even setting us up for strokes in the future. So when our immunity goes down, we know that we can get sick more easily, and we're more susceptible to getting things like pneumonia, the flu, common cold, and just more susceptible to getting illnesses. And this is something that happens to us. So this might be a point where we want to sit down and have a talk with our doctor about our immunity, about what possible vaccinations are available to help protect us from some of these diseases, and what foods and perhaps nutrients you should be consuming, and what particular lifestyle patterns can help to enhance your immunity. And we are going to talk about that. Other things that can happen is our blood vessels become less pliable or less elastic, and so they're not able to relax as well. And so this can predispose us to high blood pressure. Another big thing that happens as we get older is that our skin becomes less able to make vitamin D. And so we're more prone to vitamin D deficiencies. Now, vitamin D deficiency, as we know, can predispose us to osteoporosis. Vitamin D also plays a role in helping to keep our immune system balanced. And so this can also contribute to our issues with immunity. So when we're looking at these things, we see that these are changes that can happen as we get older. In fact, in many cases, they do start happening. And so what I usually recommend is, before we jump right in and start taking supplements, we want to have a chat with our physician, with our healthcare provider that says, listen, I know that I may be more susceptible to these illnesses, so I want to have these levels evaluated. I want to know if I'm deficient. I want to know if I'm eating well. I want to know if I'm feeding my body the things that it needs in order to age well. Never make aging an excuse for you being in chronic pain, or for you not being able to live to your best potential, because aging does have many changes. But what we need to be aware of those changes so we can compensate for those changes, right? So we want to be able to get older as vibrantly as we know that we can. So having said all of that, what are some nutrients perhaps that can help us to do just that? Remembering the first rule that nutrition is foundational. So the first nutrient I want to talk about is magnesium. This is a very common deficiency as we get older. Actually, it's a common deficiency even in younger individuals. And as we get older, we are more predisposed to that. A couple of reasons might be, again, our stomach doesn't absorb as well, our intestinal system doesn't absorb as well. When we have an imbalance in the intestinal system, what happens, magnesium can get bound up in the intestinal system and not be absorbed. And other things that can happen as well is that the magnesium in our foods are much less than they used to be. So those foods that were traditionally high in magnesium may have significantly less magnesium based on the conditions in which they were grown. So magnesium is an important one. Though magnesium comes in many forms, and I always get asked which is the most absorbable, and the most common form, of course, is magnesium oxide, and I'm not the biggest fan of magnesium oxide because I haven't really seen it work as well. So there are forms like magnesium citrate, magnesium glycinate, the magnesium orotate, and so what magnesium actually contributes to, magnesium can contribute to having you have healthier blood pressure. Also, it can help you to maintain better moods as well, and it even contributes to detoxification, and it could also help to decrease inflammation as well. There's some studies that show magnesium levels actually happens to help to reduce that common inflammatory marker, C-reactive protein, that many of us have heard about. Another big one is vitamin B12. This is very, very dependent on normal stomach acid, very, very dependent on it. And vitamin B12 deficiency can be relatively common. So even if we are not vegetarians, I know many of you are familiar with the concern that vegetarians and vegans may run into more of an issue with vitamin B12 deficiency, and that may be so, and they can very well supplement that. But keep in mind that meat eaters can as well, because as we get older, our ability to absorb vitamin B12 becomes less. Now, when you have that level checked, you might notice that normal runs anywhere from 200 to 1100. Let me say, from my practice, what I have noted in my practice, that anyone with a level of 200 and 300 tend not to do and feel as well as somebody with perhaps levels in the 500s. And again, that's within a normal range. Everybody's going to be to feel differently at different levels, but I've consistently found that levels in the 200s and 300 does not seem to be conducive with us feeling our best. Another thing that's important is omega-3s. Now remember, we talked about as we get older, that inflammation can increase, right? And so we know that inflammation contributes to chronic illnesses, right? We know that inflammation can contribute to depression. And so we want to consume things that keep that inflammation, that excessive inflammation, in check. Some inflammation is necessary. Too much inflammation can actually cause us harm. Some things that are anti-inflammatory, as we know, are those fabulous omega-3s that we find in nuts such as walnuts and almonds, but also very heavy in fish products as well, such as sardines, anchovies, salmon, and things along those lines. It decreased omega-3s that have been shown to help us improve our moods, perhaps even help with decrease our risk of heart disease, and of course decrease our inflammatory markers, and believe it or not, has been associated or linked to the decreased risk of cancers as well, such as breast cancer. then we are talking about fiber. Young and old together, many of us do not get the amount of fiber that we need. And why is fiber important? Well, fiber helps to feed the good bacteria in the gut. But fiber also helps to keep us regular, also helps to kind of bind up all those toxins that can get reabsorbed and kind of takes them out of the system. And adequate fiber has actually been linked to a decreased risk in cancers such as colon cancer. And yes, even breast cancer has been linked to that as well, particularly if you consume adequate fiber as a younger woman. So what's adequate fiber? We're talking about 25 to 30 grams a day, sometimes 40 grams if you're a male, a little bit higher than that. And so we want to pay attention to the amount of fiber in our foods. Can we take supplemental fiber? Yes. Sometimes we can on days that we are not consuming adequate fiber in our diet, but really pay attention to the fiber in your diet. That is the most user-friendly fiber to the body. That includes soluble and insoluble. Then both have very distinct roles in our health. What about probiotics? Well, as we get older, inflammation increases. That impacts the probiotics in our gut. Probiotics are good bacteria, can actually help us to absorb nutrients, make nutrients, contribute to decrease inflammation, and on we go with the recent studies that are happening. So sometimes we may need to supplement with probiotics, or we may need to pay attention to consuming foods that provide natural probiotics, such as fermented foods. Now, what about zinc and immunity? Well, yes, there have been many studies that link zinc to enhancing our immunity, but be aware, please, that too much zinc can actually have the opposite effect of what you were expecting. And so if you do an excessive amount of zinc, you may find yourself actually having a reduced immunity, which can be an issue, and it's the exact opposite of what you need. Now, while zinc levels are very infrequently checked, a common blood work that's done called comprehensive metabolic profile has a level in there called alkaline phosphatase. I know this is jumbo to you, but when that level is inadequate, it usually is indicative of insufficient zinc being in your system. And so zinc supplementation may be necessary. I usually encourage my patients not to exceed 30 milligrams of zinc a day unless it's in a very short term, unless it's just for a short amount of time. Again, because excessive zinc can be a problem. Interesting fact, the highest zinc food is oysters. For those of you who like oysters, oysters are very high in zinc, pumpkin seeds as well. So vitamin D, what about vitamin D? Well, this is the one that is commonly checked, easily checked, and we want to be able to check the vitamin D level in the blood, and it's vitamin D25, and we want to see what that level is. Now, if your level is below 30, I usually recommend that you supplement with vitamin D. As we roll into these winter months, not so much for us in Florida, but for others out in the other parts of the country, there's definitely less sunlight exposure. We're definitely covered up, so our vitamin D level goes down. Immunity, this is the time that we tend to get sick and exposure to all these germs, and so we want to make sure we have healthy vitamin D levels going into the summer. Now, potassium is also important to have in your diet, and you might supplement, but not necessarily. So I usually recommend potassium be consumed in the diet. Sometimes you might need to supplement it. If you have a kidney condition, please chat with your doctor before doing any kind of supplemental potassium, as that can be an issue. Focus on high potassium foods, because potassium and sodium actually kind of yin and yang of each other. And as we know, in our current dietary system, we have a lot of sodium, but maybe not so much potassium. And so there's definitely an imbalance with that. And so that might predispose us to higher blood pressure that comes along with a slew of problems, cardiovascular disease, strokes, just a slew of problems with that. So be conscious of your potassium levels being normal. Also be aware that potassium keeps the heart rhythm normal, as well as magnesium keeps the heart rhythm normal as well. Other lifestyle habits that can help to support stronger bones are things that we discussed before. we want to exercise, we want to eat well, we want to eat anti-inflammatory foods, because inflammation has been shown to even play a role in osteopenia and osteoporosis as well. That is like thinning of the bones. So today I wanted to jump in here with you and just discuss a few things that could be contributing to some changes that can happen as you get older, and perhaps some things that you want to consider discussing with your physician and checking out with your physician to see if you have sufficient amount of these nutrients so that you can age as well as you possibly can and enjoy vitality well into your 50s and 60s and 70s and 80s and really no end to it. And so hopefully this has been helpful. I am Dr. Udine Harry with Dr. Harry's Healthy Corner. Until next time, bye-bye.